What is type 2 diabetes? Who is at risk? What are the causes and symptoms?
So type 2 diabetes is the type of diabetes which occurs in the vast majority of diabetic individuals. The overwhelming majority, whether you look at statistics worldwide, the overwhelming contributor of the burden of diabetes is type 2 diabetes. So type 2 diabetes occurs when there is a relative deficiency of insulin as opposed to an absolute deficiency, which is what occurs in type 1 diabetes. So in type 2, there is a relative insulin deficiency and there is what is known as insulin resistance. So whatever insulin is being secreted by the body is not able to act as it should. And that is why the glucose in the body tends to rise and the patient develops diabetes. The causes of type 2 diabetes are if there is a genetic risk of diabetes, so if there's a first degree relation in the family who happens to have type 2 diabetes, if the individual is obese, is hypertensive, has an abnormal lipid profile, that is the cholesterol in the body tends, if that is abnormal, if there is a history of gestational diabetes, which is pregnancy, which is diabetes which has occurred in the previous pregnancy in a lady, then that lady would be at a higher risk of developing type 2 diabetes. Also, the condition which we come across quite frequently in adolescent and young women these days, which is polycystic ovarian syndrome. So, if there is a lady who has PCOS, as it is known, then she stands at a higher risk of developing type 2 diabetes. Also, hypertension is a cause, is one of the factors associated with type 2 diabetes. So, if there's a hypertensive individual, then there is a greater risk of developing type 2 diabetes.